I really had gotten to the point that it was affecting my quality of life. I would wake up in the morning feeling badly. I would go to work. Sometimes I would be doubled over because of the pain. I mean, it was significant pain. And I would come home and usually just go to bed.
Maria Bates had had enough of the pain that came with her endometriosis. Her OB/GYN, Dr. Dean Davis, suggested a surgical solution, a hysterectomy using the Vinci surgical robot.
With the Vinci system, we're now able to do much more difficult hysterectomies with minimally invasive procedures using that system.
Spartanburg Regional Healthcare System offers some of the region's most experienced Vinci robotic surgeons, including Dr. James Hunter.
With this technology, this is a tremendous advancement in what we can do for them and in their care. It's almost revolutionary.
Da Vinci's robotic surgery arms are controlled by the surgeon sitting at a console. The surgeon guides the tiny instruments into 3 to 4 small incisions, freeing the uterus to be removed. Because there's no large incision, there's less pain, less scarring, less blood loss, fewer complications, and a shorter hospital stay.
It is one of the greatest innovations in gynecologic surgery ever. It allows the patients to have a procedure done and most of the time go home the next day. The morbidity or the side effects from a surgery are far, far less than open laparotomy or a big incision. And it's very amenable to gynecologic patients.
Maria was driving in a week and happy to be back at work.
I certainly think, again, knowing folks who've had hysterectomies, the old-fashioned way, so to speak, you know, you're out 6 to 8 weeks. And so I appreciated the fact that I didn't have to be. You know, I work outside the home. I am a director of a nonprofit, and so any time that I didn't have to be out of the office was very, very valuable to me.
Spartanburg Regional's robotic surgery program is the most experienced in the state and offers many other surgical treatments for women.
The most common GYN cancer is endometrial cancer, and it's by far the most we do, use Da Vinci for. Following that, we do something called radical hysterectomies for cervical cancer that's localized. That also is a much easier way to get folks in and out of the hospital. 5 years ago, those patients stay in the hospital 3 to 4 days. Now they go home the next day.
In addition to Da Vinci, Spartanburg Regional also offers many other innovative treatments and tests for women. One of them, a blood test for older mothers to determine the genetic makeup of their unborn baby with much less risk of infection or miscarriage.
Subsequently, they've come up with a test where they can actually just simply draw blood from the mother, send it to special labs where they are then able to find some of the baby's genetics within the mother's blood and run the test and tell you whether the baby has a trisomy 21 or Down syndrome or another type of genetic defect.
Surgical advancements, innovative treatments for women, the highest quality care at Spartanburg Regional.